introduce our moderator for today, Dr. Sharon Batista. Dr. Batista is a board-certified psychiatrist and assistant clinical professor of psychiatry at the Mount Sinai Hospital. She is a distinguished fellow of American Psychiatric Association and American Medical Women's Association and Academy of Consultation Liaison Psychiatry. She is currently in private telepsychiatry practice based in New York City. Welcome, Dr. Batista. I'm going to turn this over to you now.
All right, so I have the honor of introducing Ben Eckstein. Ben Eckstein is a therapist specializing in the treatment of OCD, anxiety, and obsessive compulsive related disorders. Ben honed his specialty in OCD while working at McLean Hospital's OCD Institute. He's now the owner and director of Bull City Anxiety and OCD Treatment Center in Chapel Hill, North Carolina. Ben is the vice president of OCD North Carolina, the North Carolina state affiliate of the International OCD Foundation. In addition to his clinical work, Ben is a speaker, trainer, and author. His first book, Worrying is Optional, Break the Cycle of Anxiety and Rumination That Keeps You Stuck, was published in November 2023. I'm so thrilled that we chose this book for this author Q&A. I think this book was much needed, Ben. Maybe I'm a little biased. And like, what an honor to get to ask you more about your experience writing it, your interest in this topic. First of all, I'll start out. There's a lot of self-help books out there. You and I know this. I've got a lot of them on my shelf. Yours seems a little different to me. What was your inspiration for writing this book?
Yeah, so it's kind of fitting. I actually was approached by the publisher to write this book after giving a talk at the ADAA conference. And the talk was about kind of OCD and GAD and sort of this kind of overlap, right? Like that there are a lot of similarities, there's some differences, but the talk was really about kind of looking at some of these underlying processes and kind of, sort of picking apart this idea that OCD needs to be treated in this purely behavioral kind of way. And meanwhile, GAD is this purely kind of, sort of more traditional CBT approach. And the reality that, hey, like there's probably more overlap and there's probably a little bit of room to intermingle these things and kind of get to some of the underlying stuff. And so, I think with the book, well, I think I expanded on it. Wasn't just a kind of OCD versus GAD kind of thing, but I think it was really wanting to tap into that idea that, I think worry is this transdiagnostic problem, right? Like people getting stuck in their thoughts and perseverating and, right, like not knowing how to manage that internal experience. This is a thing that shows up in a whole bunch of different diagnoses. And I think kind of looking under the hood of that and figuring out, okay, so you experience this thing, what's driving your worry, right? So is that some behavioral reinforcement? Is that cognitive distortion? Are you fused with those thoughts? Do you have particular beliefs about your worry, right? Like that, I think there are all these different things that kind of underpin that experience. And so, yeah, I think I really wanted to tap into that as opposed to just, hey, here's, I don't know, CBT for worry, right? Like that I wanted to not just have a transdiagnostic approach, but also kind of blend a bunch of different modalities in looking at it.
Yeah. What appealed to me personally was that there's some universality in this. Like you don't have to have a particular diagnosis to experience worry. It's part of the human experience. Of course, some people suffer and are more distressed by it than others. This varies person by person. And so I thought that like there's some element that we can all take away from. Really appealed to me in the way you laid out this book.
Yeah. Well, and I think that was kind of intentional on my part in saying like, I think yes, this is probably helpful for folks with OCD or GAD or panic or depression, but I think it's also helpful for folks who don't meet the diagnostic criteria for anything. I think we all experience worry at times, and we have to figure out how to navigate that.
Yeah. Because not everyone probably has seen the book. This is pretty recent new book anyway. I'm curious about like some lingo, if that's okay with you, just to orient us a bit. What is worry? And like, if you could explain that.
Yeah.
We don't all know.
Yeah. So I would point out this difference, and I talk about this a lot in the book, but the difference between worry and worrying. So the title of the book, it's kind of catchy. I think a lot of people hear it and they're like, oh, like, what's that all about? Like, worrying is optional. I don't know. And I'll say, like, I had some mixed feelings about the title. It was the publisher was pretty into it, and I've had more mixed feelings, but the publisher did come up with a tagline which I really liked, which is essentially worry happens, worrying is optional. And I think for me that speaks more to what I'm trying to get at, which is this idea that, hey, we all have worry. We all have things in our lives that we care about, that are important to us, that we want to make sure go well, right? Like that. I think that's a very natural human experience, to be aware of these things that we care about and to have some discomfort at the idea that those things might be in jeopardy. But that idea of worry, so this sort of more automatic thought that comes up, a bad thing could happen, right? That's just sort of a, unintentional thing that just happens to us. That's very different than worrying, which is the verb, right? Like that more active process where now we're more actively kind of examining things, or, running simulations in our heads, right? Like that there's a more active interaction with it. And so, yeah, I think distinguishing between those two things, that sort of automatic worry that just happens, as opposed to this more deliberate, effortful process, I think is really, really important. I think a lot of people get kind of stuck there, right? Like that they're trying to banish worry, as if we can exist in this way where we're just
make it illegal or something.
Yeah, right. Like that we're just oblivious to all of the things. We don't have a care in the world, right? Like that's probably
you must control your thoughts.
Yeah. Yeah, and we don't really do that. And I don't think that's the goal, is to just stop caring or stop being aware of things. I think it's to have a more intentional relationship to those cares and worries, and to kind of respond to it in ways that better fit for us.
Well, I guess jumping off on of that comment, in the book you do talk about worry as a behavior that we engage in, and you just kind of alluded to that, I think, in that description.
Yeah.
Instead of it being something that happens to us at random, which I feel like as a human experience, like we're all like in our thoughts all the time, and the thoughts just come, right? Like whatever, like however they come and they spontaneously. Could you expand on that perspective shift and how it could be empowering to people to address their worry?
Yeah. Yeah, and I think this is a place where I get a lot of pushback from people, because I think that idea that, hey, this is an intentional behavior that you're doing, I think often doesn't always fit with how they've experienced it, that it feels like something really automatic and it just happens and I don't have any control. Like I'm just kind of at the mercy of my brain and my thoughts. And I think the distinction that I try to make there is that automatic is not the same as inevitable, and it doesn't mean that we don't have any power over it. And so I absolutely believe my clients when they tell me this just happens automatically. I'm sure that it does, right? It has become habit and it happens without thinking. And I think for many people, there's this very kind of well-worn path that they just end up going down without even thinking about it, right? And that I think that's kind of habit in a nutshell, right? Like it's this stuff that we do without having to really think, right? Like it gets moved into that more automatic kind of place in our minds where it's not effortful anymore. It's just happening. But we can change that, right? Like we're familiar with habits, right? Like that they're not set in stone. They can be changed. It takes some practice and some effort, and we have to get really intentional with it. But yeah, there are ways that we can start to shift these things. And I think the same thing is true of worrying. Just because you more automatically lapse into that process doesn't mean you can't cultivate better awareness of that and find ways to intervene and ultimately kind of reshape what that path looks like. So yeah, I think for me, I think the big takeaway there is just that, yes, this might be automatic, but that doesn't mean you don't have some control over it. And just to be clear, when we're saying control, we're not saying the initial thought. We're not saying the worry. We're saying the response to that worry, what you do with it. So
you can't control what you think, but you can control what you do about it.
Yeah, right. So like you can't control the stuff that shows up, right? Like the
Yeah.
things you notice, the things you become aware of. But you can, to some degree, control whether or not you choose to pick that thing up and examine it and try to make sense of it. And right, like all of that subsequent stuff where now we're analyzing and right, like that there's more happening there than just an automatic thing.
Mhm.
Yeah.
So, this makes me kind of wonder, what are some common misconceptions that people have about worry? Maybe like what worry does or means for
Yeah.
us, and how do you challenge that? How does your book challenge these assumptions?
Yeah. So I think that's really important. And I think in the book, I think this is a place where I borrow a lot from metacognitive therapy in looking at some of those positive beliefs about worry. And I think as therapists, I think we're usually kind of programmed to say like, oh, positive beliefs are good, negative beliefs are bad, right? Like that we want to encourage everyone to be really positive and everything's great. And I think this is a place where those positive beliefs are actually kind of unhelpful. And so those positive beliefs are things like worrying is helpful. And I think this is one that I get a lot is like, hey, if I didn't worry, bad things would happen, right? Like
Like,
that,
I'd
hey,
be
I
on my
have
game. I'd be prepared.
exactly,
Right.
right? Like that I think it's and I think there are people are just kind of confusing worrying for something else, for something like planning or problem solving or studying or right like that. I think those more active things, which are actually helpful, those things are different than worry. And so I use this example a lot, but like, you know, I think about studying where if I have a test coming up on Friday and I want to do well, if I worry about that test, it's not going to go any better. It's not going to change the outcome of that test. Studying will change that, right? If I choose to spend my week studying for the test, I can actually prepare, I can learn the information, I can review the information. This stuff is all helpful. I may do better on the test. But just worrying about it won't actually change that outcome. And I think this is a mistake that people make a lot, is they're assuming that because I worried and everything turned out okay, that worry is the
Mhm.
reason why it turned out okay. And that's not
Okay.
really, that's not accurate. So yeah, I think that positive belief of, hey, this is helping me, you know, things worked out okay because I did this. I think that's one that we really want to challenge. Um, I think another one that I also want to challenge is kind of this idea of, you know, worrying, you know, like essentially like I'm not capable of managing this experience without worry, right? Like that it's not just it's going to get me the outcome that I want, but
Yeah.
it's more like I won't be okay if I'm not worrying, right? Like that I can't handle that uncertainty without doing something about it, or I can't bear the anticipation, right? Like that I need to do something to relieve this feeling.
Mhm.
And again, I don't think that's true, right? Like that worrying is generally not helping us to make our way through these experiences. We are capable of tolerating uncomfortable stuff without necessarily delving into this kind of mental churning. Um,
Mhm.
so yeah, there are a few of them out there, but yeah, I think we do want to help people to just examine those beliefs, right? And I think this is a place for kind of, you know, things like behavioral experiments and right, like just kind of tinkering around with it. I think the studying one is a good example where, you know, if I let's say I study for 10 hours and I get an A, I might assume that I need to study for 10 hours in order to get that A. But now we can play around with that. Like, what happens if I study for 8 hours? What happens if I study for 2 hours or not at all? Right. Like that. I think we want to
Uh-huh.
find, hey, like, where's the lower limit of like, you know, where does this stop being effective and useful? And I think when we studying is useful, but if we're thinking about something like worrying, you know, and our belief is, hey, this is the thing responsible for these positive outcomes, I think we want to play around with that and saying, hey, what happens if I subtract this from the equation? Like, can I still get some of these positive outcomes, even if I'm not doing this behavior?
Yeah.
Yeah.
Yeah. It's that's totally, I think, like rocking my world in terms of the culture we live in, right? Because like we really, I think, ascribe a lot to like care a lot about this thing. The
Mhm.
more I devote to it, like the better it'll turn out, or the more prepared I'll be, or the better I'll like handle it or make a decision. And you're right, like that the math doesn't always add up.
Yeah.
Um, yeah.
Yeah. And I think you highlighted another one there and just kind of conflating worrying for caring.
Mhm.
Right. And like I think for many people, and maybe that is kind of a cultural thing. It's kind of, a way that we demonstrate care is by worrying about things, but we're not actually helping anyone by worrying. We're not making things better, and I think ultimately there are probably other ways to demonstrate care other than worrying about things.
Mhm.
So yeah, I think it's important just to examine these things, that I think it's not just worry. I think we often end up with a lot of these sort of habits and things that we do, and it might have been helpful or functional at some point, and then we kind of stopped checking to see if it was still useful. And I think this is one of those things that often hits that point of diminishing returns where it's not useful anymore, and yet we keep
Yeah.
doing it without really questioning that.
Yeah. It gets outdated kind of.
Yeah.
Um, it comes to mind maybe that you could have like a one-time worry thought and that like it comes and it goes, right? And that's not what we're talking about today. We're talking about something that I think is more of a process, potentially repetitive, kind of, I'll say resource consuming, like
Yeah.
time consuming as a resource. You talk a lot about rumination in the book, which I think is kind of some lingo, but useful lingo. Can you talk about that a bit? Is that what we're kind of highlighting here? And how is that a problem, if so?
Yeah. So rumination, I use a lot of these terms sort of interchangeably. And I think there are a lot of folks who kind of distinguish between something like worrying versus rumination. And, I think there are a bunch of these different categories. So I think there's rumination, there's mental review, there's mental checking, there's this kind of forecasting or running simulations about what could happen, there's analysis. I think they're all different ways, and maybe there are some subtle differences between some of these things, but they're all kind of different ways of just describing these mental processes, right? Like it's a thing happening in our heads where we're examining something. And any of these things by themselves they're not bad. Mentally reviewing something that happened. I don't know if I get off of this webinar and I'm like, oh, I've stepped it. I said all the wrong things. I totally blew it. Hey, there might be something helpful about saying, okay, maybe next time do this or don't do that. We can learn from things that happen. Mental review is not bad or unhelpful. But there's some point where it crosses this line and stops being helpful. So if we have learned what we can learn and we're still turning it over and turning it over, we've already gotten what we need to get out of it. And it's kind of a gross example, but even that word rumination, right? Like that, I don't know if people know like what a lot of
I had to
bovine
look that up a
cows,
long
right?
time
Like
ago.
that,
Yeah.
yeah. And there's also a disorder, a thing called rumination disorder where
Yeah.
people do the same thing. But
Not related.
yeah, right, not related. Uh, but it's this idea, there are some animals who they eat food, they absorb some nutrients, and they regurgitate it again, and then eat it again
Yeah,
and
like
get
cows,
more
I
nutrients.
think,
Yeah, it's
and yeah,
cows, a lot of hooved animals.
yeah,
And that's what it's gross, but that's fine, right? Like
that's
that's
the
how their
word.
digestive systems work. That's their thing. It's okay.
Yeah.
But I think that idea that, hey, when we're ruminating, we're kind of doing the same. We're doing this mental version of, hey, we're pulling up this thing again to try to extract something out of it. But each time it's sort of, there's this point of diminishing returns. We're getting less and less out of it every time. And I think about that mental review kind of idea. Hey, if I walk away from this webinar, yeah, maybe there'll be a couple pointers or things that I can maybe do differently the next time. If I review it again and again and again, right? Like the stuff that I'm going to glean from that is going to stop being helpful, right? Like it's going to veer into, okay, now I'm being critical, or now I'm picking up on things that are really not that important. So yeah, I think we really want to just kind of notice this point where these things stop being useful. And I don't care so much, hey, do we call it rumination? Do we call it mental review? I don't really care so much about that, but I do think it's important for people to have some understanding of their own flavor of this. Some people are
Yeah.
more likely to pour over past things. Some people get really stuck trying to anticipate future things. I think it's helpful to know your own kind of proprietary blend of like, hey, what are those things that get in the way for you? Because we're all a little different.
Yeah, for me, I my expression is like down the rabbit hole kind of like,
Yeah. Yeah.
like how I personally think I experience it when I experience it. It takes me like off track, right?
Yeah.
Onto its own track.
Yep.
Yeah.
Yeah. Um, it happens quickly sometimes. But I think that's, and maybe that's a lot of why it's helpful to just be more aware of it. So I think when we can say like, hey, like I know this thing that I do, right? Like it's a habit, I get stuck in it. I think that helps us to build that awareness, so I think when we're kind of looking at it, when we've already flagged it as a thing that we do, then hopefully in that moment when it's happening, we're a little bit more aware and we catch it a little bit sooner because we're sort of on the lookout for it.
Well, maybe that's this is a good point to ask my next question. We got a bunch of questions written in advance. And I think there are some questions coming in now as well. A lot of people wrote asking for like, how can I get started? Like, how do I understand how to address this? Are there steps I can take? Where do I begin? Some people requested like tips for managing their own anxiety, especially say when the going gets rough, such as like it's hard at night or it's hard if they're having panic attacks. Are there any highlights that you could suggest like looking into?
Yeah. So, I mean, I guess I'll start by saying, I have a lot of little tidbits and kernels of wisdom and, things that I'll recommend. But I think this is also like part of the book is saying like, hey, there's no one thing that's going to solve this problem, right? Like it's a pretty complicated problem, and they're usually, we're talking about the positive beliefs and like cultivating awareness, right? Like there are a bunch of different parts of this, and I think they're all necessary, So I guess the first thing I would say is like, hey, there's no kind of magic bullet here, right? That you're probably going to have to work at this and come at it from a few different angles. I
Hmm.
think the place to start is in cultivating awareness. And so and maybe this is a place where I've pulled from a lot of different things in this book. And so one of the things that I really like comes from a treatment for body focused repetitive behaviors. So things like hair pulling or skin picking. Um, and one of the ways that we'll often have people kind of track these behaviors is using this idea of, they call it SCAMP, which is an acronym for sensory, cognitive, affective, motor, and place, right? So like essentially what we're saying is, hey, like we're going to do this log, in this case, when you're hair pulling or skin picking, and we're really trying to get this really thorough snapshot of that moment when you're, in this case, hair pulling. Um, and we want to know, like, hey, what is the sensory experience? What are the thoughts coming along with it? What are the feelings? What's the circumstance, right? Like, we want this
Yeah.
really fleshed out kind of snapshot of that moment. And in that case, we're then going to take that and build these interventions accordingly, right? So if we're saying, hey, with this example, you're I don't know, skin picking because your skin feels rough and it's this sensory kind of experience, then we're going to find another like sensory intervention. There's something that you can do to, soothe that feeling or to,
Mhm.
get stimulation or whatever it might be in that moment.
Mhm.
So I generally, again, I appreciate hair pulling, skin picking are not exactly the same thing as worrying, but I like to borrow from that kind of approach in saying, hey, we want to do a log. And I think part of cultivating awareness is not just saying like, oh yeah, I was worrying at 7 o'clock, but it's saying like, okay, well, what was going on, right? Like what were you doing? Were you bored? Were there critical thoughts? Was there some stressor? Were you hungry? Were you tired? Right? Like, I think we
Uh-huh.
really want to tap into all of these different things that are showing up in that moment.
Mhm.
Um, and
Like all the
I don't
forces at play, kind of.
exactly. And I think it's for the same reason, that there is no one size fits all approach to managing worry. And so I think we really do have to tap into, okay, what's driving this for you? And then what kind of intervention would be helpful? And so if you're doing that log and yeah, it turns out you're really bored. Okay, well, then we need to find some things for you to be doing to manage that boredom, or we need to work on distress tolerance so you can get through that feeling of boredom, right? Like we need to
Yeah.
tailor an intervention. Um,
Yeah.
Same thing like we were talking about before. If the thing driving it in that moment is you had the belief, hey, like I think I need to worry in order for this to be okay, then yeah, we probably want to do some work on kind of challenging some of those beliefs, right? So I think this act of cultivating awareness, of keeping a log, I think it's really just to give us this jumping off point to then figure out, okay, what intervention would fit here. And chances are it's going to be a series of different interventions. I have not yet encountered anyone where it's just been like, oh, it's this thing, right? It's the one thing. I just need to address that, and then I'm good. For most people, it's a combination of stuff.
Mhm. Um, Something comes to mind along the lines of like, so you use skin picking, hair pulling as a like comparison, right? And I think it's a good comparison because it's like a behavior, like it's noticeable, it's external, and so it's pretty like obvious maybe. It's very distressing to people who suffer from it, especially on a clinical level. And so is worrying, although it's not external usually. And so that could be really tricky to kind of figure out. And then I think that the purpose of treating skin picking or hair pulling is to like not damage your body, right? Not to harm yourself. And maybe there's other purposes, but and so values came up in the book and like how it orients a person to like do they change the worry behavior process or not. Can you talk about that a little bit?
Yeah. Yeah. When a lot of the work that I do involves treatments that have some degree of distress, whether that's exposure and OCD or, yeah, just learning to tolerate uncomfortable feelings, right? Like it's not always, I think people feel better after seeing me, but it's not always like a feel-good treatment all the time. And so I think it is really important that people have clarity around why they're doing this and what's important. And I think with worrying, I'd say the same thing of hair pulling or skin picking. These things aren't inherently bad, right? Like you're not harming other people. They're not wrong, or there's not like a moral component to this. I think they're problematic, just like any mental health problem. They're problematic because they're getting in the way of living your life in some way, right? Like they're interfering with showing up in the way that you want to show up and being the person who you want to be. I think with worry, that often comes in the form of just taking time away from spending it on other stuff that you care about. I also see it showing up a lot in, and we kind of alluded to this before, but I think that conflation of worry with caring, right? So like if I were to say, hey, one of my values is, I don't know, caring for the planet, and then I spend all day worrying about global warming, right? Like I think it's tempting to say like, yeah, this is my value. I care a lot about it. And so I'm going to think about it all day. And it's like, well,
Right.
yeah, that's not really how we want to demonstrate that care. There's a lot of ways that you can care for the planet. Thinking about it is probably not very high on that list.
Right. It's not like productive, like it's not going to
Right,
change carbon emissions or
right,
plant more trees or whatever.
right.
Yeah.
So yeah, I think that ability to get clarity around what our values are, and then also to break that down and say like, okay, so how do you want to move towards those values? What does that actually look like? What are the goals associated with that? How do you operationalize this value? And again, I think when you frame it in that way, like, okay, so how do we operationalize this? Most people are not going to say, I want to think about it a lot, right? Like that if I say, hey, I really care about my kids, how do I want to kind of, I don't know, embody that in my life? It's not going to be like, sit in a room away from my kids and think about them, right? Like that's not really it. Um,
Right.
so yeah, I think values are important both in giving us kind of purpose and reason for sitting with uncomfortable stuff, but also then in kind of refining where living those values actually really differs from engaging in some of these behaviors.
Mhm. Yeah. That's awesome.
Yeah.
We just had a couple more rumination focused questions come in, so I'm going to kind of put them together.
Yeah. Okay.
Um, One person asked, could ruminating be part of the healing or getting over it process? I'm assuming like getting past something difficult that happened, maybe. And then another person asked, when does rumination become OCD? So maybe if you want to
Yeah.
to that a bit.
Yeah. 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 So that first one, could it be part of kind of healing or processing something that happened? I'm going to get a little semantic here and saying like,
Uh-huh.
I I would say rumination. No, I don't think rumination is ever helpful. But I want to distinguish rumination from thinking, right? Like in the same way that I would say like worrying by definition is unhelpful. But that doesn't mean problem solving or planning or analyze, right?
Uh-huh.
Like that, I think we want to make a distinction between these versions of it, which kind of again, by definition, they've kind of they've stopped being useful. We're just churning and kind of spinning our gears. So yeah, I mean, I think we do need to think about things. I'm not making a pitch for like don't ever think about stuff. Like just like I don't know, like be in the present moment all the time and never put a single thought into anything. Like that's not what I'm making a pitch for. But I think we do want to be intentional about that process. And so I think if something has happened and it feels important to kind of to wrap your head around that, to make sense of it, to process it in some way, I would encourage people to just be really mindful about how you do that. And I think if there are ways to operationalize it, I would always try to skew in that direction. So I think if that means writing something about it or finding some way to express it, obviously, like going to therapy, I think is another way to do that. But
Uh-huh.
yeah, I think just getting kind of more clear on, hey, like where would this behavior be helpful and where is it going to stop being helpful? And I think in general, like we don't process things because we've just thought about them a lot. I think
Yeah.
we gain some insights, we come to some better understanding of it. We do it by continuing to live our lives in the presence of these uncomfortable things, right? Like there's a lot of different ways to process. And yes, I think thinking about it is one way to do it, but I think we want to be careful because it is something that can kind of lapse into this really unhelpful territory. Um,
Yeah, I envision worry is kind of like a circle or a loop or a spiral, and like with like no end. Um, and like processing, you're usually coming to like further kind of like evolution of where you're at about a thing, whatever that
mhm.
thing is. So it's kind of like processing probably has more of a path to
Yeah,
it.
yeah, I
Yeah.
agree. And I it's a good question. And like I think in the answer you can see like, yeah, like the lines are kind of blurry sometimes.
Yeah.
Like there's
Yeah.
not a perfect way to delineate this stuff. Um, the like visual that I sometimes think about that's helpful for me is in kind of like zooming in on a picture where like there's some point where you zoom in on a picture and sometimes you'll get more details and you'll learn new things by zooming in. Depending on the quality of that picture, you're going to hit some point where no matter how much you zoom, like it's like a blurry picture zoomed in is still blurry, right? Like it doesn't
Yeah.
matter, it doesn't make a difference. And I think that's kind of the thing. Like, yeah, we can look at these things and examine them. There's some point where we kind of know, if we know the pros and cons, we know all the little nooks and crannies of this thing, and yeah, we're just not going to get much more out of it. Um, and I think it's okay if we learn that by crossing the line. I think that's often
Mhm.
what it does look like for people, where you've been thinking about something and you hit that point, you're like, you know what, like I've been doing this for a while. I haven't learned anything new. Like I think I've crossed the line already.
Yeah.
And that's okay. If that's how you figure it out because like you went too far, like that's fine. There's nothing wrong with that. I think that's how a lot of people do it. But I think it just kind of goes to show that like you can't either way, you're going to kind of, if you stop examining something prematurely, that's fine too, right? Like that it's not a crime to not squeeze every little bit of insight out of something. I think we're doing our best to try to figure out where that line is, and it's just sort of imperfect.
Mhm. Yeah.
Um, the second question, yeah, where does this become OCD? And I'll say, like, I think that like the talk that I initially gave at ADAA was kind of addressing that issue of like, hey, these things can look really similar. So with OCD, a lot of people are familiar with some of those tangible compulsions, so things like checking or hand washing. There are also things called mental compulsions, and these are things that people just kind of do in their heads, and sometimes that looks like could be replacing a thought or thinking a positive thought after a negative thought. So sometimes it is this like very kind of clear reaction. There's some initial thought, and now here's a mental thing that I do. But sometimes that's analysis and rumination and just like turning things over in our heads. There's a sort of OCD subtype that people refer to as pure O, which usually ruffles the feathers of a lot of OCD specialists because we would say like, well, it's not purely obsessional. It's an obsession with mental compulsions. So yeah, I think with OCD, yes, you absolutely have these things that are just, it's rumination, essentially. That's the compulsion. So that is not so different than something like GAD or rumination. I think I personally, as a clinician, I don't get too stuck on these things. And I think we're often hitting on a blurry diagnostic category when our answer is essentially like, well, if you have other obsessions, if you have other compulsions that you do, if everything else looks like OCD, we're going to call it OCD. If the only thing you do is ruminate and worry, we're going to call it GAD. And so, yeah, I think any time you find yourself saying like, well, like, what else is going on? I think that kind of tells you these categories are a little blurry. So yeah, there used to be in the DSM this kind of qualifier with OCD that essentially said like, hey, the content of the obsessions needs to be sort of bizarre or strange or kind of disproportionate to the thing. And they got rid of that. Like it's not in
true.
there anymore.
Yeah.
And I think the removal of that, I think further kind of clouded that distinction. And I think it makes sense. I think with OCD, you have obsessions around lots of everyday stuff. They're not always bizarre or disproportionate. I think there are lots of worries about
Not in the least. Yeah.
yeah, relationships or, there's lots of things that are kind of typical everyday things. So where does it become OCD? Again, I think that answer of like, well, if there are other obsessions and compulsions, that's usually a good indicator. I think that idea of, hey, GAD is kind of everyday worries, just a little excessive. And, I think that I don't know, that one, it's not a perfect descriptor for me, right? Like that, I think that it is a little blurry.
Yeah, I know. Yeah, these are the semantics, but maybe like that's where we get a bit distracted by trying to really pin it down.
Yeah, I agree. And I think where I always end up is saying like, well, it doesn't really matter here because we're going to do the same thing either way. If we call it OCD or we call it GAD, we're still going to respond by saying, hey, we need to disrupt this process. We need to, if it's OCD, we're going to say, hey, we need to eliminate the compulsions. If it's GAD, we're going to say, hey, we need to figure out how to disengage from worrying. And they're the same.
It's still about
Yeah.
not doing the same course of behavior because it's causing distress or it's causing suffering or taking away from your life. Yeah. That's like, I think like where it's more of a unifier than like that we're separating these things out. Let me see. I have a couple more questions. We're gonna put in the chat. Someone asked reminder of like what's the name of your book, and how to find it. Oh, now it's magically in the chat. Thank you. So, worrying is optional by Ben Eckstein, and we still have a few more questions coming in now. Let me just look at them for a second. So one person asked, and this is along the lines of like, how to go about this. How can you get unstuck from worrying? Because this is like kind of like one of those like really sticky, very it draws you in kind of processes.
Yeah. Yep. Yeah. And so I think there are a bunch of answers to that question. There's not just one. The first one, we talked about already, so I won't belabor it, but the first step is like you have to be aware of it. And so what I'm about to say next, I think is kind of built on this assumption that, hey, in that moment, you were able to flag worrying. And so I think it's important there just because you may have already lapsed into worrying. You may be doing it. And so we're talking about disengaging from it in that moment where you catch yourself. We're not necessarily talking about preventing it. We're saying, okay, you've noticed it. Now we need to disengage. So yeah, I think there are a few different ways to do that. And it probably will depend again on that initial kind of formulation of what's driving it in that moment. And I think that is going to determine what you do to disengage. I think a thing that I see as sort of a common thread for a lot of people with worrying is some amount of acceptance. And so I think having sort of a practice here to know how to kind of manage that. So if I don't know, I'm worried something bad might happen to my kids. I am not with my kids right now. I don't know if they're okay or not. I assume they're fine, but I don't know, right? Like I can't know right here in the moment. And so I'm going to have to practice that acceptance of, hey, right here, right now, I don't know the answer to this. And it helps me to sometimes think about these other places where we're accepting of uncertainty, right? And so like I often think about the like I don't know standard stuff that people deal with, like sock got lost in the laundry, I don't know where it is, right? Like it's gone, I'm never going to see it again. Or the one that always gets me is like the ending of The Sopranos, which I won't give away, but it's notoriously ambiguous. And right, like that gets people, right? That like, ugh, like I don't know the answer and I want to know. And so like I think in those moments, getting really clear on, hey, this is super uncomfortable. I don't like it. I want to know the answer and I can't. And I can pore over this all day. It's not going to move me any closer to the answer. Again,
No.
I think about The Sopranos,
Like,
right?
we're
Like
just never gonna
you,
know.
you watch that last episode over and over again. You will not know.
Yeah.
Again, I don't want to spoil it, but like
Yeah.
you don't get an answer. It doesn't matter how many times you do it. And so I sometimes will have people kind of like write a little script, right? Like a kind of a thing that they can refer to in that moment. And here is a little different than kind of like an exposure script, which is meant to be really triggering and kind of and uncomfortable. But here we're talking more about like sort of an acceptance script. We're saying like, hey, what do I need to do to channel that mindset where I'm saying, okay, I don't have an answer, I don't like it, but I'm going
Yeah.
to move forward without knowing.
Yeah.
I think for a lot of people, and again, I think this is a place in the book where I am kind of borrowing from other modalities. And I think attention training is another one of those things that I think a lot of people have to get a handle on, right? Like that I think for many people who worry, it feels like their attention is just commandeered by that worry, right? So the worry shows up and they're
Yeah.
immersed in it, they're engaging with it, and they don't
Powerful.
have, yeah, they don't have any kind of ability to put that attention spotlight where they want to put it. Um, and I think, again, I think this is a thing that people often assume is just like, well, that's the
Eh,
brain I have, like that's how it is, that's how
right.
it'll always be.
Right.
And that's not it, right? Like you can practice that and get better
Yeah.
at it. And so yeah, I often will have people practice learning how to kind of train their attention. And I won't go into all the details of it here. You can Google attention training and find some
Fine.
exercises.
Yeah.
Um, but I mean, I think I think essentially you want to just get a feel for it. And this example may not resonate for some people, but it's how I always think about it, at least. The first car I drove was a stick shift, and you have to like get a feel for, there's the clutch and there's the brake, and right, like you have to get a feel for like you put the clutch and the gas, and like there's this like nice little like equilibrium that you find where you go into gear or out of gear. And I always think about that with attention, where like we're just trying to kind of like get a feel for like where is that point? Like how do we shift our attention in these different directions? That difference between kind of awareness of things versus paying attention to things, right? So like right now in this moment, I am aware of lots of stuff, right? Like I might be tired or hungry, and I noticed like the light is like now shining on my chest in this kind of weird, but like I'm aware of tons of stuff.
Yeah.
If my brain's doing its job, it's limiting all of those things to just the things that are relevant, right? Like that we're trying to tune out the stuff that's kind of superfluous, or it's not
Right.
necessary, it's not an immediate need, and
Right.
we're going to put our little attention spotlight where we need it. And so I think the tricky thing here is that our brains do this automatically, but they do it imperfectly, right? And so like I think
Yeah.
that idea that we are going to focus on what's relevant and important, this is true, but it's not perfect. So I'll
Yeah.
the example that I give in my book is that I went to college in Vermont and I grew up in Massachusetts. So when I would drive home, it was like 3 hour drive. And I would always like, I'd be like, I would always have to pull over. So I was always tired and kind of dozing off. And but like the thing that I noticed is like going to school in Vermont, if I was driving in the middle of like a blizzard, I was wide awake, right? Like, and I think the thing that stood out to me there is like, so I could be like driving 10 miles an hour, cushioned by snowbanks, right? Like that blizzards are a little dangerous, but
Yeah.
like I was not actually in that much. I'm going 10 miles an hour. Like, I'm gonna bump into something. Like, what's the worst that could happen? And meanwhile, driving 75 on the highway, I'm falling asleep. And it's like my brain isn't correctly triaging that, right? Like it's not sizing up that situation appropriately. So like in that moment where I'm actually like in a beautiful little cozy snow cushion, right? Like my brain's like, whoa, danger, pay attention.
Yeah.
And meanwhile, like when I'm speeding on the highway, it doesn't care and I'm falling asleep. And so I think in that moment, what I would do is sometimes I'd pull over, but sometimes I'd like roll down the window or turn on the music or like that I would do these things to help me to put my attention where I wanted to put it. And so
Yeah.
I just trying to kind of illustrate there that like, yes, this is an automatic thing that our brains do, but sometimes our brains don't do it well and we
And
need
there's
to
decision
give it a
making.
little assist. Yeah. So I think learning that skill of, hey, how do I put my attention where I want it? When my brain is saying, analyze this, pick it apart, put all of your attention on this issue, I need to be able to say, okay, I'm actually going to refocus my attention on the present moment. And it's a little tricky. I think it's hard to do it without veering into avoidance or distraction, right? Like that we're just trying to really come back to what we're doing. The way I always think about that one is like kind of like a mosquito bite where like if you scratch it, it's going to be really itchy. If you try not to think about it, it's going to be really itchy. The way we manage it is really just to like get re-engaged in living our lives. And when we do that, the awareness of that mosquito bite just kind of recedes to the background, right? Like we're not pushing it out. We're not trying not to think about it. We're showing our brains that the priority is whatever's right in front of us. And when we do that, our brain stops noticing. And I think that's a lot of what we're trying to do with that attention training and kind of disengaging from worrying is it's really just re-engaging in what we want and allowing it to recede on its own.
Yeah. Yeah. Those are great analogies. Funny, I thought of a car analogy, different one too, kind of randomly there. So interesting. I guess we're on the same wavelength here.
There you go.
One more, I think, question I wish had come in earlier, but we had quite a few questions in advance from family members and loved ones saying, well, how do I help my loved one? We had some questions from peers, colleagues, therapists who, how can I point my patient client in the right direction? Someone wrote in just now that they're suffering from anxiety. How do they get into the right treatment, find the right therapist? They're concerned about being taken seriously for the problem. Do you have any advice about how to get the right treatment?
Yeah, I do. I think you have to kind of know what you're looking for. And if you really want to ruffle my feathers, like one of the phrases that really kind of pisses me off is that idea of like worried well, right? Like it's this really dismissive term for folks who are struggling with worry, but they're functioning, they're going to their job, they're doing the things they need to do. And I think it's really dismissive. And I think when you're seeking help, I think this is a thing that you have to be mindful of, is that I think there are a lot of people who dismiss worry when people are functioning and otherwise kind of getting through their lives. And so, yeah, I think you have to find people who treat worry and anxiety and kind of know the difference, right? Like that this is, yes, we all have worries, of course, but when people are really distressed, when people are having their lives impacted by this, yeah, it does need to be taken seriously. I know ADAA has a provider directory, and so I'll put in a plug there, right? Like that I think in general, not to vouch for every single person there, but in general, these are people who are going to be caring about anxiety and depression and are usually going to be practicing evidence-based treatments. And so, I think that's usually a good place to start. I think there are some other organizations out there that kind of vet therapists and ensure that they're using evidence-based practices. I think for me, I think that's kind of the the buzzword here, right? Like that I think you want someone who is actually going to apply a treatment model and not just do talk therapy. And I don't mean to put down talk therapy. I think it's a supportive therapy is a wonderful thing. I think there's a time and place for it. But I think with things like worry, with anxiety, certainly OCD, right? Like that process of just rehashing the things that are going on, you're just
Yeah.
worrying out loud or doing compulsions out loud if you were talking about OCD. And so, yeah, I think you do have to be mindful of that. That, I think talk therapy again has a time and place, but it will not help these problems. So I think you really want to prioritize finding someone who is going to actually apply an evidence-based practice.
And I think we don't have time left today to like go into all of what that means, about what are evidence-based practices, what types of therapies would be considered, how do you find a therapist who's like qualified and skilled. There is info on the ADAA site a bit about these different therapies that I think is really high quality. So that's like one very reputable source. I think the Academy of Behavioral and Cognitive Therapists has some info for the public as well, similarly, and there's others. But so I people who are asking about this, because there's more questions coming in, like I think like find your professional organizations that speak to this concern, and they'll probably have resources to educate yourself and figure out therapists who are aligned with that evidence-based treatment. Was my suggestion is like a big picture suggestion. I know we're pretty much out of time, and I gotta thank all 500-ish people who registered for this webinar, and thank you, Ben, because you don't know this, but you gave me the pleasure, of getting to have this conversation with you. This is fun for me. I really enjoyed this, and so thank you all for making this happen for me personally, and thank you for your time, because I know this is time out of your day, and you're really, really busy in your practice. Congratulations again on your book. This was a really awesome discussion.
Thank you. Yeah, I really appreciate it. Love having the opportunity to talk to you all.